To treat or not to treat? I had a 1-month-old patient who presented to me with flu, cough, and a left armpit swelling for 1 week. On examination, it was actually a left axillary lymph nodes measuring about 2 × 2 cm, non-tender and no overlying skin changes. So patient was diagnosed as BCG lymphadenitis and ultrasound confirmed it as a non-suppurative type, and she was treated conservatively. However, in view of concurrent infection, she was actually treated with antibiotic, but the swelling actually reduced in size over time and she was just followed up as outpatient. 2 months later, patient had a recurrent left axillary lymphadenitis, but this time it was bigger, more fluctuant but still non-tender. A repeated ultrasound confirmed a suppurative component of the lymph node. She was then referred to a surgeon for fine needle aspiration, but only minimal pus aspirated. She was covered with IV antibiotic as the infective markers were raised, but the swelling remained to be huge. So we consulted the pediatric surgeon and the infectious disease team, and surgical excision was offered in view of a large persistent suppurative lymphadenitis. So patient subsequently recovered well without recurrence, and the pus culture was positive for MTV complex, which includes a Mycobacterium bovis. So what is the treatment of BCG lymphadenitis? At this point of time, it's still controversial and there is no universally established treatment guideline. But in general, for an uncomplicated case, a wait-and-see approach with a regular follow-up is generally practiced. In case of a suppurative lymphadenitis, a pus drainage by FNAC is the treatment of choice. However, a surgical removal should be considered if the aspiration is unsuccessful, there is a persistent large lymph node with multiloculated pus, or there is a formation of sinus. Anti-TB medications are generally not indicated, especially if the culture is positive for Mycobacterium bovis. And lately, more and more data to suggest that early surgical excision might provide a better recovery, so who knows. If you have any other opinion, please leave a comment down there for further discussion.